Good afternoon, everybody, and welcome to our webinar number 28. Today is all about abdominal recovery, be it from athletic performance, injury, postpartum, or surgery. And then we'll also look at how we can use our Spidertech kinesiology tape to help with things like cramping and bloating. And so a wide-ranging topic today. It is something that we can use very quickly, very effectively in the clinic. We can have a giant impact and really help a lot of people. And really, this should be for the clinician that is specialized, also has a wide variety of patient base. So as we dive right in today, as always, we at Spidertech are aiming to provide you with the highest quality products so you can pass that on to your patients. And that highest quality product is made here right in North America from start to finish, and is something you can rely on from a quality standpoint in the materials, but also a manufacturing and a distribution standpoint as well. So we are going to give you the best quality product, and you get to use that with your patients. Myself, the history I have using Spidertech for abdominal issues, I really started in the tennis world, doing a lot of traveling, being in different places all around the world in different weeks. Certainly cramping, whether it's from illness or food-based or just not feeling great, from delayed onset muscle soreness. There's many reasons why the stomach gets upset, and we have to play through it. So we got good at using tape as the modality that allows the tennis players that we work with to compete and to play as well as they could, even though maybe they weren't feeling quite as at 100%. That also has taken us into, we've done a bunch of work postpartum with diastasis recti, both from a clinical study standpoint, helping hospitals and helping groups to finish clinical studies. We have our gentle material is one that is unique and easy in the skin, so it was very attractive for clinical studies and hospitals and nurses trying to kind of provide the best products for their patients postpartum. And then also trying to get the most out of our lung function from a cardiovascular standpoint, from a performance standpoint, being able to maximize the strength and function of our diaphragm and also of our posture during athletic activity. So wide-ranging, and excited to kind of get right into this one. We're going to keep our goals real simple. We're going to go over why we would use it. We're going to use some clinical studies to highlight the results that we would expect to see, both from a expected outcome, pain improvement, function standpoint, and then we'll also dive into how we can use Spidertech, how we can apply Spidertech to make sure you're getting the most out of the application standpoint today when you see your patients. Our specialty at Spidertech is that we do produce pre-made, prefabricated tape that it comes in different shapes and sizes for different parts of the body. Certainly it makes your life easier because you're getting the quality, but also it speeds things up and that you don't have to use scissors. It makes it reliable and reproducible. You can apply it anywhere. And so the different applications that we'll go over, we'll kind of touch on how we can use the different styles and types of tape for all those different pieces. So with our strategies, we're going to dive into how we can improve posture, a breaking in the connective tissue of the abdominals with diastasis recti, how we can boost athletic performance, and really that comes down to lung function and being able to perform longer and better and more effectively. We'll go over how we can use it post-op, and that touches on kind of how the lymphatic system can be improved by using Spidertech. And then last, we'll go into cramping, menstrual type symptoms, and how we can use this with other modalities to get the most benefit for your patients. An interesting one and a good place to start from my experience would be our postures. It's one that, as a clinician, I would say this could touch on multiple different diagnoses. So we could see that, I guess the primary function with this study was to limit anterior pelvic tilt, but anterior pelvic tilt could show up with many different diagnoses, and could be the root cause of many issues. In this study, they looked at using tape on the abdominals and the hamstrings, and so tension, strain in those muscles could be the reason for it. We also could be looking at if they just keep falling into those postures, which affects pain elsewhere. We could also use this as a postural improvement to help upstream or downstream type conditions. So with this study, and as always, we're bringing you the latest and best research. This one is application of kinesio tape to treat hyperlordosis, more effective on abdominal muscle or hamstring. So going in, my bias certainly is that the abdominals would be something that I would tend to tape a lot faster and to help kind of an anterior pelvic tilt or hyperlordosis with my patients. And I guess it's simple in that I feel like if we're trying to correct a hyperlordosis by getting tape on the hamstrings to pull the pelvis forward, I feel like that leaves us vulnerable to a lot of different issues, mainly skin irritation, because it's a big wide area that we're having to have a correction on, which means we're putting some tension in the tape, which means the skin is at risk of being irritated. For me, this seems like the answer would probably have to be the abdominals, where we can have the person take. I generally would have them lying on their back, and then just kind of tape from ribs to pelvis. And what that would do would be anytime they kind of get going forward, that it would help kind of give that reminder to correct or to kind of pull into a position where we're more cylindrical, or like where the ribs were kind of opening up into the rib cage a little more naturally. And so what they did here, and this was a quick study in that they didn't go very long, but you can see the different applications here where we had the abdominal tape is kind of pelvis to ribs. They used 25% stretch in this application, and then they also did an application that went kind of around over top of the obliques. And then the other one here would be the hamstrings, where they tape from knee to pelvis attachment, and again with that 25% tension, trying to pull the pelvis into posterior pelvic tilt would be their goal here, I'm assuming. And so as we can see here with our benefits, my bias kind of holds true in that we get more results with the abdominal taping. I think it's a taping that would provide more benefit based on the study, less downside based on just the mechanics of how it works and the vulnerability of the area of skin-wise, and so, but also one that's really easy to do in the clinic. And so I think this would be an easy answer or an easy go-to with all of your patients who show up with hyperlordosis or anterior pelvic tilt. I think it is one that I've been successful with over the years, and it's kind of one of those things where you can throw it on as the adjunct, as the final move. Explain it or don't, but I think you'll end up improving the condition that you're working on. And then if we look at just the bare numbers, kind of drive down into the stats here, they looked at immediately, so before and after tape, and then 24 hours later, and then we see that after 24 hours of taping the abdominals, there's an 8-degree change in the lordosis in the lumbar spine, and so a very significant improvement. There still was an improvement with the taping of the hamstrings. After 24 hours, we got a 3-degree improvement. But the thing I also like is instantly with the abdominal taping, they got a 2-degree improvement, where with the hamstring group they didn't see any improvement at all. And it is nice to get those kind of jumping off the table and feeling that little different position right away. So I think an application that tuck away and start to use with all of your patients. And then to conclude, the application of kinesio tape on the abdominal muscles and hamstrings could reduce hyperlordosis in females after 24 hours. This reduction was more significant after taping the abdominal muscles. So yeah, fantastic study, and gives us I think a tool or an idea as to you can help a lot of people as this type of posture is quite common in the clinic. If we go through how I would generally tape for this type of application, I would keep it real simple. I'm going to work around the belly button, the umbilicus. I'm going to go kind of pelvis to ribs, and I generally would do it without tension. So in this position, our patient is lying on his back, so there's certainly that's going to take out a little bit of the lordosis generally. So this is kind of in the position we want him to get to. So my guess is if you were doing this, when they would stand up, then there'd be more arch in the back. And so just by taping like this with no stretch in the tape, we're taking the position we want him to end up with, which is a flatter back. And so anytime he gets into that lordotic posture, we're going to get a reminder through the tape to straighten things up, flatten things up, and take a more of a kind of a neutral position. And then by doing this too, I feel that there's almost no downside in terms of skin irritation from the tape having too much tension in it. We're going to get some stretch and some reminder, but we're never going to get into the place where the tape exceeds the amount of stretch that is possible, and that's when we would get tension strain on the skin, and we'd end up with kind of a burn or irritation from the tape itself. Okay, so if we take a detour away from changing posture, and certainly this can be thought of with our diastasis recti patients as well, but we'll kind of take a little bit of a different role here, or a different move here, and we'll look at the taping in a rectus abdominis diastasis treatment and abdominal circumference improvements in postpartum women. And so this one here we're looking at both from a pain standpoint postpartum, but also from a how well do we lose weight, we kind of regain or lower our waist circumference after giving birth. And certainly diastasis recti being is a very common issue to have after birth, based on just the stretch and the increased size that we get in the abdomen. Well, women get in the abdomen, and so as a result, the connective tissue can stretch and break in some cases. And so even after we heal, there's times where that break in the connective tissue maintains, and we don't get back. It also right after giving birth is an important time to support the abdominal muscles, the connective tissue, to aid in the healing right after the birthing process. So it's one that again would recommend to kind of as a preventative move to just help regain the tissue quality or the tissue continuity after giving birth. And it's an interesting topic in that there's a ton of research that shows the same thing where we're going to see here, where the circumference of the abdomen, the quality of the connective tissue improves significantly after using tape. So if we dive in here, and again a new study from 2024 of interest. This is the way that they taped for the application. I like it. I think it's very intriguing. I think it's interesting. I think it uses a lot of tape, but that, I guess, if we're going for maximal improvement, this would be a good way to do so. At the end here, we'll also go over how I generally would tape for this type, for someone with diastasis who's past birth or not even hasn't got that point yet, and we're dealing more with functional athletic standpoints. But from this point, I think this is a very interesting application, and it is, whether we use this many crisscrosses or we don't, I think this is the way that we internally have found the most benefit as well. I think our intuition initially was to kind of go more straight across the abdomen, because you would think intuitively you just want to pull that connective tissue together. But you can envision that the tape wants to stretch lengthwise. It doesn't stretch widthwise, and so if we go just straight parallel to the ground or parallel to kind of the pelvis, then anytime we kind of get into extension, that we're dealing with tape which doesn't have any give to it from a width standpoint. So I think the angular kind of rib to pelvis in a contralateral way is one that we get the best of both worlds. We can deal with extension, we can deal with rotation, and we're never going to run out of stretch in the tape, which again would irritate that skin. And so some great improvements here. Certainly from a pain standpoint, in total, before and after treatment, we're looking at almost a 50% improvement in pain after using our kinesiology tape, and then the most being in our severe cases here, where there's a 56% improvement in pain for women who just give birth and who have severe diastasis. And so for those are the ones that obviously you can tell right away. So those are also the ones that we're going to get the most benefit. But even from a mild standpoint, where maybe visually you couldn't even tell that was there, there still was a 35% improvement in pain with those situations or those cases. And then of interest as well, if we're looking at kind of waist circumference at the umbilicus, at the belly button, we saw that there was a 5 centimeter decrease after 2 weeks of use, and this is all after 2 weeks. And then above umbilicus, we saw a 3 centimeter. Below umbilicus, we saw a 3 centimeter. There wasn't as much in a longitudinal standpoint. We saw a 2 centimeter from Ziffy processed umbilicus decrease, but I mean, these centimeters are very noticeable, and you see the images of the improvement after 2 weeks, and it's very significant. I mean, clearly there's going to be an improvement just in the natural healing process after giving birth, but I think the tape helps in a very meaningful way. And so if we can do something as simple as help our new mothers kind of get some tape on their abdomen, it could be and this is never going to be the only thing that they do. So it probably leads to other conversations about how their body is feeling as clinicians, and so they can, if they're having the time to spend with you to put tape on in the first moments after giving birth, well, then they're probably going to also bring up other issues that they're having, and there's other modalities that you can use as well to help the healing process based on their needs. So it's just a really good opportunity to get in front of your moms and to help them, and not just with tape and decreasing pain and waist size, but also you never know where the conversation leads to. So I think a nice, again, idea, if we take the same way as someone comes in with hyperlordosis, we're getting tape on the abs, same way with the moms that you've helped with treatment all through their pregnancy. It's just another continuation of that 2 weeks postpartum that you can be helpful. And then they conclude, preliminary analysis shows that the effect of kinesiotaping is in promoting rectus abdominis diastasis recovery and improving abdominal circumference and anterior abdominal size. Additionally, rectus abdominis diastasis was positively correlated with lower abdominal circumference and anterior abdominal injury. And clearly we want to do more studies on this to show, well, just exactly the amount of improvement that you can see, but from this study we see some pretty impressive numbers. And so before we dive into the next study, this is one of the areas too that's been quite interesting, in that I've worked with some athletes and certainly some tennis players who most recently who have developed diastasis, and theirs obviously wasn't from pregnancy, but it was just from being so fit and demanding on their abdominals at a young age, and as a result the connective tissue has stretched or broken, and then trying to find solutions to make it so that doesn't impact them in their sport and in their life, and so generally the places we've found the most issue is when they're overhead, and you can imagine with kind of like in tennis it's the serve and the kind of coming across the body rotation that the serve takes, but really anytime we're up overhead we get kind of that contralateral diagonal type of contraction if you think of the abs on right and left side of the body. So it's kind of like the abs are a piece of the obliques as well. I work with the obliques to kind of to go from high to low, right to left. And so where we've seen the most benefit here is that we take that same diagonal type tape application. We usually can get away with just one strip on either side of the abdominals, going from high ribs to low pelvis, and then kind of on the opposite side. So right high, left low, and then left high, left low. It allows for maximal rotation. There's no limitation in ranges of motion, but it helps to connect also the abdominal wall when we do need things to contract in a coordinated way. I've found that we've seen that with the diastasis tends to lead to the abdominals kind of contracting in ways that normally wouldn't if the connective tissue was whole and was as it would normally be, and so we kind of get into positions where we just get some cramping or overloading through the abdominals, where the average athlete wouldn't see that. So by doing that, by getting the tape and the connection, you can imagine that if we're going high right, low left, that's always going to create a bit of pull because of the elasticity in the tape into midline, and we'll do the same thing on both sides. So everything's kind of being pulled into midline, and we can absorb the pull, absorb the shock of the connective tissue, in my opinion, and then also we don't ever get that pull apart, which in my opinion leads to the cramping of the abdominals, the abdominals from right to left, which don't react the same as they normally would. And so by just simply getting tape high and low, we can seemingly help have the athlete not even recognize there's an issue where cramping or pain had been a big problem in the past. All right, if we dive into taping the abdomen, at this point no longer for our diastasis, but if we're looking at being able to improve our lung function, our athletic function while we train, then this, again, a very interesting study from 2022. They looked at called the concurrent effect of inspiratory muscle training and kinesiotaping on inspiratory muscle pressure in athletes. And so what they did was they had two groups, and they did the training, their aerobic, anaerobic training. They did their diaphragmatic strengthening, and they did their ability to run at certain speeds with and without tape, and some pretty interesting ideas here. So if we look at just pure your maximal inspiratory pressure, as we can see here, which essentially is your ability to inhale against resistance, and so Group A being our group with our tape, and Group B being the group that did the exact same training. And this was a soccer team that they used in the study. So they looked at the same training methods, and we saw after our study was finished, which was 2 weeks, an 18% improvement in our kinesiology tape group versus an 11% improvement in our non-kinesiology tape group. And if we dive into our Cooper's test, which is just running for 12 minutes and seeing how far we get, we see that there was a 14% improvement in our tape group, 10% in our non-tape group, and then our VO2 max training group, where they evaluated just your VO2 max before and after. We saw a 19 or 20% improvement if we're rounding up in our tape group, and a 12% improvement if we didn't. So huge improvements here. My assumption is that they taped for the abdomen to be in a better posture. They taped, which helped to allow the diaphragm to strengthen, to allow the use the lung function as maximal as possible. In this case, they taped both around the lower ribs into the abdominals, both in through the front and the back. So they taped the back as well, trying to kind of get the most coverage over top where the diaphragm would sit. I believe it would help to kind of keep the person out of an anterior pelvic tilt or a hyperlordosis. And so again, we're just keeping the ribs stacked up properly so our diaphragm can be used effectively, efficiently, and all of a sudden we're able to get the most out of our training, which turns into faster numbers, more strength in our ability to breathe, and also just the pure VO2 max abilities of the athletes. And of interest, these are also not people who had issues. These are people who are on a soccer team who already were well-trained young athletes. So if you can transfer these ideas to someone who maybe had breathing issues, if someone who was detrained, if someone who had an anterior pelvic tilt and the ribs flared out like crazy, I think you probably would see an even better or even bigger improvements here in a faster way. So they concluded that the encouraging results of the study showed that the concurrent application of inspiratory muscles training and kinesio taping improves inspiratory muscle pressure in athletes. And again, the interesting point here is that they did nothing different, just tape versus no tape. It seems so simple. Those are huge improvements. And I mean, there was no increased effort. There was no extra training day. There was no, giving 110% with someone only giving 105%. It was the same group doing the same things and getting different results, getting improved results based on, I think, keeping your postures, keeping your positions in a more efficient way, so your body can get the most out of the training. I kind of liken it to training without having enough protein in your body. Like you can do it and you'll get benefits, but you're robbing yourself of the maximal benefits by not preparing your body, by not allowing your body to express its optimal function. And so if we dive into how one way we could tape for diaphragmatic benefit here, with this application, which we'll pull up in a second here, with this application, it's going to be, there we go. A lot of times I would use this one for diaphragmatic cramping, and that a lot of times you'll see it on the patient's right-hand side, just based on the anatomy of it and where the diaphragm sits in relation to the ribs and the spine. So, but if we were using this for in a way to try to increase our training, like the study, I would generally go both sides here and get coverage, allowing the ribs to kind of stay down to get stimulation over top of the diaphragm, the abdominals, and the ribs on both sides. And I think that would be a great application to kind of go crisscross like so. And so this is our low back Pro Cut with Spidertech. I would say that really the thought process I think would be similar to what we just said with the diastasis recti, in that if we kind of went like across rib to pelvis on contralateral way, I think that would be a great way to get it, to dig into it as well. Hopefully matching the ones we see in their study. And I think we've seen it a couple times here too that I'm going to generally try to avoid getting tape over top of the umbilicus. It's an area that can be irritated. It's an area that it's a break in the skin contact, so it would be the place where generally the tape would start to pull off the fastest. And so with any tape application, if there's space between the skin and the tape, that's where it's going to start to come off first, and so that would be kind of the break in the connection between the tape and skin. So I would generally try to avoid that. I'm also going to avoid areas where we see hair. First reason is that the hair doesn't feel great when you take it off, and so if you are taking it off over hair, you'll essentially want to take it in the direction the hair grows, so you're not pulling it up, you're not waxing the person. But also we need flush contact with the skin, and so the hair, a little bit of hair can actually be beneficial because we get more stimulation because we get kind of pull on the hair. But if the tape can't be flush with the skin and create that bond with the adhesive, then it just sits up too high, and it's never going to stay more than like a day or so. And so be aware of that. A little bit of hair is good. Too much hair is never going to work. And then just make sure we get flush contact with the tape and the skin to allow it to stay as long as possible. Okay. So we'll dive into our last two topics, and they kind of are similar in that this topic is kind of post-op. It looks at the ability for swelling to go away, for pain to go away. The swelling piece is kind of similar to what we saw previously with our postpartum diastasis piece, where we saw that centimeters were shedding off with tape use. And I think that a lot of that is from the tape, because of elasticity pulling up on the skin and allowing the fluid to move out like it normally would through our lymphatic system. And we don't get pooling, we don't get congestion in our lymphatic vessels, and so they're open, and the fluid can move out as fast or as they would normally. So I think that those two things blend in quite reasonably, and that this is kind of the same mechanism. And so if we look at anything kind of post-op here, and they looked at multiple surgeries within this study, and they all got the same result. So with this study in 2026, again, as new as it gets, the effective kinesio tape application on post-operative pain in patients undergoing laparoscopic gynecological surgery for benign reasons. So there is multiple benign reasons, and it is a RCT. And interestingly, here is the tape that they applied. Obviously, within this situation, we want to avoid the incisions, so that's something they managed to do. I would say it's not exactly the prettiest application we'll ever see. I would say that the people that put this on maybe weren't going for longevity. And in this study, I think they only had the tape on for 2 days at a time, and then they put new stuff on, which makes sense. But I think we could find a better way to do it. Certainly, depending on the different types of incisions that we see, you have to be creative. But what I generally would try to stay away from is the adhesive in the tape is going to adhere to skin better than it does to other tape. And so we see here that we have some crossover. That would be the place where we would start to roll up the fastest, and when it rolls up, then it continues into the area where the skin is, and that's where we lose our application. I mean, this has just been put on, and we see that, or even if this was put on for 2 days earlier, either way, we see the corners are kind of rolling up. This application is not going to stay on much longer. I like the crisscross method, like kind of high to low. I think that's good. I would try to keep that directional going. And then we'll also see with a lot of lower abdominal issues, they just go a piece of tape right across the lower abdomen, and which is, I mean, it is a tough area to get at. Pubic hair matters. Obviously, we're trying to avoid that, and so I think for this application, we see this type of like straight across the lower abdominal, the abdomen, quite commonly with this, with C-sections, with really anything that we're looking for scars or lower incisions and through that part of the body. So I think this is totally reasonable, other than the fact I wouldn't crisscross the tape. I wouldn't have the tape ending over top of other tape. It can cross, because then it still connects to the skin above and below. But I would really try to avoid having the tape finish over top of other pieces of tape. And then if we dive in here, we see that pre to post-op with the tape group, which is we see that there is, which is the first category, there was no difference in pain before and after the surgery, where without the tape group, they went from 1 out of 10 to 4 to 10. The tape group generally went up from 1 to 1, so I'm intrigued they got the same whole numbers here, but essentially we're seeing less pain in a significant way. But I think where the most intriguing thing here is that after surgery we see a 21% decrease in the amount of NSAID that the person required to be able to kind of stay at that pain level. The diclofenac sodium was the NSAID that they decided to use. So on average, there was 21 people required 21% less of that to keep them at their pain level, and that's I guess the reason why they stayed at a 1 is because they were full of pain medications. But in our non-tape group, they didn't. They still took more pain medications, higher amounts, higher dose of pain medication, and they didn't have the same pain results. So that's significant. And then the acetaminophen, we also saw there's a 21 or 25% decrease in the amount of acetaminophen needed. So for both our anti-inflammatory and our pain medication, we see that in the mid 20s decrease in amount needed to be taken to maintain the same pain level. So as people get more natural, as people understand that maybe we won't want to take as many pain meds and with the other effects it has on the body, by just putting tape around the abdomen, this seems like a pretty reasonable thing to be doing. And then if we kind of extrapolate this, like after surgeries of the knees, after surgeries of all the other parts of the bodies, we have the hip, we see that these same results are seen, where we get less swelling, less pain, and less pain medication required by just putting tape on. And again, the tape being put on also leads to other conversations that you can help patients, but it's just an easy check-in, and they're going to benefit from it in a real way. So conclusion here is long, but it is because they check so many things, and it's a very important piece. So this randomized controlled trial provides compelling evidence that kinesiotape application significantly reduces post-operative pain, enhances mobilization, and decreases analgesic consumption in patients undergoing laparoscopic gynecological surgery for benign conditions. The intervention safety profile simplicity, again, the safety profile is insanely high. Simplicity, very simple. That's the beautiful thing about kinesiology tape. And cost effectiveness supports its integration into standard post-operative care protocols. The findings demonstrate clinically meaningful improvements in both subjective and objective pain measures, along with enhanced functional recovery parameters. These benefits contribute to improved patient experience and align with enhanced recovery after surgery principles aimed at optimizing post-operative outcomes. Healthcare providers should consider incorporating kinesio tape as an adjunct or adjuvant therapy in multimodal pain management strategies for laparoscopic gynecological procedures. The evidence supports kinesiology tape's role in reducing medication dependence while improving patient comfort and recovering trajectories. This would be a great thing and makes a whole lot of sense to be done in the hospital. It makes a whole lot of sense to be given this and be taken home with them so people can put it on themselves. You can also choose to do it in your clinic. But either way, if you're the person who's giving this recommendation, you're the one that gets the credit for helping your patients in a really meaningful way. And as always, chances are it's not just tape you're doing for them. Chances are there's a bunch of other things that you're doing, other modalities you're using to help improve their conditions. And so we see these big improvements by a small piece of the puzzle. This is it. So that's where things get really exciting, because tape is going to be the last thing you do in addition to everything else you're doing. So a really interesting and compelling study right here. And so we saw that in that study that they just used the strips of a roll. A lot of times, if we're dealing with swelling, if we're dealing with lymphatic issues, that's where I'm going to use the fan from Spidertech. It comes pre-cut like this, and so you're not fumbling with scissors, you're not getting your hands all over the adhesive. It takes 2 seconds to put on, as you can see here, and we get the most effectiveness in terms of allowing the fluid to move out of the area, in terms of getting coverage over the area. So this would be for someone who had like this video would generally be someone who had like a splenic lymphatic drainage issues, but really for any lymphatic or swelling in the abdomen in this area, this would be exactly how I would tape. So in our previous study where it was more gynecological, I would use this exact same application around the umbilicus into like the lower abdomen, just above the pubic hair, and I would expect to get even better results than what they saw with the study. The nice thing about the small pieces and small strips is that you can maneuver it around any incision as well. So that's where this fan can be really useful, is that you can move around any part of the skin, any incision mark, any bandage that you want, and still get as close and as much kind of pull up, lift up in the skin to help the fluid move out as possible. All right, fantastic. So as we dive into our last two studies, and they look at the same thing, last two, but an interesting piece of the puzzle, and this was one of the ones that too, when you dive into the research, all of a sudden you're like, whoa, there's a lot here, in something I didn't really expect there'd be a lot for, research quantity-wise, but there's a lot. So with this study, and I believe a 2024 study, it was, which I don't believe I know, it is looking at the comparative effects of exercise combined with kinesiotaping and electrotherapy in women with primary dysmenorrhea, a randomized controlled clinical trial. So essentially we're looking at menstrual cramping, and we're looking at the effect of kinesiology tape and IFC on in exercise in helping people with cramping, helping young ladies with cramping. And so something, again, very meaningful, something from an athletic standpoint. Again, there's a lot of athletes who will change their schedule, change their training around if their period of cramping is very significant, if they feel they can't compete in the same level, that affects a big part of their life. Also for non-athletes, if just function and the debilitating pain that some people get with cramping is something that happens to your patients, and this can be really meaningful. Also, I really like is that this is a multimodal approach. We're hitting it with exercise, we're hitting it with IFC, we're hitting it with tape. We're comparing those two things, where I would generally in the clinic exercise, IFC, and tape, which I think we can expect even greater results than we see with this study. So of interest, this is what we see with taping application for the cramping. We see that they do both anterior and posterior, so front and back taping. I mean, it's as simple as it gets. I think we can have a greater impact. If over the back, I would generally not go straight across. As soon as you flex forwards, there's not going to be any give in that tape. So I would generally kind of go along the erectors more vertically than horizontally. but they still get good results here. So, and then we have our crisscross, our cross pattern here in the anterior abdomen. Sure, I mean, I think that's great. I would generally maybe go more of like what we saw with the original video we did, where we get more of like a V, so it's like it starts low and then kind of like fans up around the umbilicus. But if you're using this for every patient who has cramping issues, you're going to use this a lot, and so I think you'll find out what the best results are. You'll find out where people's pain is, what people respond the best to, and so this is what I like about it is it's kind of simple and not very exciting, or not very specific, but that also tells you that if you're a little more specific and you're a little more careful, that you can probably even get better results. And then if we dive into our improvements here, our pain scale, we see that the electrotherapy plus exercise ended up with a 31% decrease in pain. We see that the kinesiology tape ended up with a 27% decrease in pain. And then painful symptoms ended up with a 10% with IFC and 12% with kinesiology tape. So again, we're seeing both of them are seeing around 30% improvement in or decreasing in cramping. We see that also their functional characteristics also improve. We would see, I think, if you combine those two things together, because they would do an IFC in your clinic and then you put tape on them and they go home. I think the reason why they're successful is very different. The IFC is certainly a more in the moment. You put it on, take it off, and then we're done. The tape is something that's there all day, every day. It's on all day, the entire time between treatments. Those two things don't overlap. Those two things don't require one or the other thinking. And so I think we can use this with exercise, and then anything else you want to throw at it in terms of massage, soft tissue techniques, in terms of any kind of joint issues or range of motion issues, or any other modalities you think are going to be helpful to get a 30% improvement, and maybe even more if you combine these two things. I think that's is pretty fantastic. And then they conclude that this study confirmed that exercise combined with either kinesiology taping or electrotherapy effectively reduces menstrual pain intensity and improves coping mechanisms in women suffering from primary dysmenorrhea. Notably, exercise combined with electrotherapy also showed significant improvement in managing negative effects in somatic complaints associated with menstrual symptoms. These findings suggest that physiotherapy, specifically exercise combined with IFC or kinesiology tape, could be incorporated into holistic treatment plans for primary dysmenorrhea, offering non-pharmacological alternative to traditional pain management strategies. So I think that's beautiful. Non-pharmacological, natural, and it's something you can help your patients with in a real meaningful way. And then if we wrap it up with our final study here, were a 2025 study looking at the effects of kinesio tape and core strengthening on pain, menstrual symptoms, and physical activity amongst non-pregnant and menstrual cramping. Primary dysmenorrhea. So if it's someone who has never been pregnant and it is dysmenorrhea from a non pathological reason, it is from our menstrual cramping. We look at a study where we're looking at young people, we're looking at healthy people, and so again, when we do this, my mind always goes to we can expect bigger, better results for people who are kind of more pathological, for people who have greater issues, have been there for longer, and so I think this is a interesting and a good study. Similar way they looked at with our combining it with exercise, and it was a longer period, over 8 weeks, than the other ones, and they concluded that combining kinesio taping and core strengthening are more effective than core strengthening alone in improving pain, menstrual symptoms, and physical activity in nulli gravida women with primary dysmenorrhea. So I think to kind of sum it up beautifully, if we add tape to whatever the abdominal region we saw today, then we're going to do better than we would do than just with our normal intervention. The Spidertech was never the sole intervention. It was always added to another intervention, but every time it did better as a result of adding it to the toolbox. So I think getting used to helping people with abdominal taping for a huge array of reasons, as we went over today, can be pretty exciting. It can be something you can help a lot of people. And I will also say it's not very well known, and so it can kind of separate you from the crowd a little bit in terms of your patients are getting something from you that they're not going to get from someone else. They're not going to get from a lot of other clinicians, which is important as we kind of build our awareness within the community, as we build our reputation within a patient base. I think all these things become pretty important, and as we try to help people get better, be better, and live a better life, I think all these things are pretty important. And so we'll see here, using our fan again, this would generally be how I would tape for our menstrual cramping. We get over and around our umbilicus, we get nice and low. We can be just above the pubic hair. We can crisscross it, which will get maximal lift in the skin. We can have control of the tape and where it goes to move around the belly button there. And a great application, and looks cool too. I mean, this is something that feels good, looks good, and will help a lot of people. All right, so as we conclude here, we had a big array of abdominal taping here. We improved posture, we improved connective tissue issues and changes in positioning of the abdominals. We improved the athletic function of some soccer players. We saw that they were able to, their lung function, the lung strength, their VO2 function all improved. We saw how it can be used post-op to get people out of pain, improve function, help them recover faster, and we can help people in a menstrual way, in a cramping way, whether it's just from a pain, whether if it's an athletic performance standpoint. These are all things that you can catch a lot of people in your patient base by just understanding the principles of what we went over today and how we can use tape to help the abdominal region. So we're 28 webinars in. I think we're learning that there's tape for every patient that you have. If you understand the building blocks, the principles of why we're doing it, it's up to you to decide who the right people is for Spidertech, but it can be the adjunct therapy for a lot of different conditions and interventions that you're already using within your clinic. Let's jump into the Q&A. We'll dive into this area, and any questions you have, please ask, and we'll kind of connect any dots that are still out there. And I'll begin with that. All of our information here, all of our webinars, all 28 of them are hosted on our school's platform. It is a place where you can go to get all this information in terms of application styles, application videos, education, why, the science behind all of our applications, and it's all there for free. As a Spidertech registered medical professional, you not only get preferred pricing on your orders and on your tape itself, but you also get all the information, all the education that people pay many hundreds of dollars for. It's all there. You can go through it at your own pace. There's message boards where you can chat, you can request. For instance, you can request our next webinar topic. And so it's a place where all of our information is. You can go and take part there. We're also kind of getting into making this more continuing education friendly. So in the future, we'll be including some more information that way to make sure that these 1 hour digestible sessions are something that you can do on your own time. You can benefit from, because it is some high level information from a kinesiology tape function pain standpoint, and so it's you'll be rewarded for tuning in and learning all about Spidertech. Thank you, Nita. If no questions about today, I recommend finally here, get the tape on your own abdomen, feel what it feels like, play with it. It's a really simple placed and finishing move to do with your patients. We can help in so many different ways, from a posture, from a waist circumference, from a recovery standpoint, and I'm quite confident that once you start and you have people come in with and see the benefits, it'll be something that you find a way to put on with with a lot of your patient base, if not everybody. So have a good afternoon, everyone. We'll see you next month, and any further questions, post on our message board in our schools, and we'll get back to you soon, and we'll get that information not only to you but to everyone else in our community. Thanks, everyone.